On today's episode, I'm talking all about the treatment of kennel cough in dogs. I'm discussing anal gland problems in cats. What's that all about? Next, I'm moving on to how to help a stressed out male cat, and then my thoughts on line breeding in pedigree dogs. Is this a good idea if you're looking for a new puppy? And then finally, are raw diets safe for dogs and cats? But first, let's cue the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Hi, and welcome to episode 6 of the Dr. Alex Answers show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, and this is the show where I answer any questions you have about how to prevent disease, how to keep your pet healthy, how to pick up on the fact that they might be unwell, and the things that you need to think about when it comes to treating them for whatever life throws their way. I'm so grateful that you're here, sharing your valuable time with me when I'm sure and I know there are going to be plenty of other things you could be listening to or other things you could be doing. If you enjoy the show, make sure you're subscribed to the podcast. And whatever your burning pet health question is, head over to dralexanswers.com to get the answer featured on an upcoming episode. And so let's jump into the first question. And this one was sent in by Lydia, and she asks, what medicine do you suggest for kennel cough, please? Well, let's start off with what kennel cough actually is. And it's actually a syndrome rather than a specific disease. So there are a number of different causes. Also, it's otherwise known as infectious tracheobronchitis. So the infectious component, lets you know that there is an infection going on, but it's caused by a number of different things. And actually, the majority of them are viral disease. Occasionally, you get a bacterial infection, but the majority are viral. And that means that antibiotics, they often have no place in treating kennel cough because they don't work for viral disease. They're only occasionally indicated in kennel cough. And really, we don't want to be overusing antibiotics. There's a whole problem with resistance developing, multi-resistant bugs. And from a veterinary side and a pet health side, we definitely don't want that in our pets. And we don't want to be contributing to that problem in humans. So moving on to kennel cough itself, when it's a viral problem, generally it's self-limiting, which means that without treatment in an otherwise well animal, it will get better by itself and it doesn't necessarily need any treatment. Problems can happen when you've got a young dog, a young puppy, when you've got an elderly dog, or if you've got a dog who's being immunosuppressed for any reason or is immunosuppressed, so their immune system isn't working very well, and they're going to be more at risk of developing complications or developing serious disease. So when do we think about treating our normal kennel cough patients? Well, if a cough is causing problems, if it's causing discomfort, so if a dog is getting quite anxious and distressed by their frequent coughing, if it's interrupting sleep as well, that's certainly those are certainly indications that we might want to start our dog on treatment. And that can include a range of different medications from anti-inflammatories to antitussives, which are also anti-cough medications. Sometimes we'll give antihistamines maybe. But then if a dog is unwell or if it's felt to be a high risk of developing one of these complications, then we might consider antibiotics. And that's going to be very much on an individual basis, but you shouldn't go into the veterinary consultation expecting and certainly demanding antibiotics because very often they're not appropriate. They're not going to help. And also, if we're using antibiotics when it's not necessary, remember they're a very broad brush, so they're not just targeting the kennel cough itself. They'll be affecting the bacteria in the guts, on the skin, throughout the body, and that's our normal healthy bacteria, and that can cause problems in itself. So something else that you can do at home would be to put your dog in a steamy room. That steam can just help to clear any mucus that's building up in your dog's throat or in its windpipe. There's the thought that honey might soothe the throat. Now, that might just be an old wives' tale. It's certainly not going to do any harm, and that might be something that you try. So I guess those are my treatment kind of suggestions for kennel cough. Definitely if your dog is unwell or if the cough is bothering your dog, if they're getting distressed, if they're uncomfortable, if they're not sleeping, you should definitely see your vet. And we've got a range of different medications in our arsenal that we could use. But a lot of the time people are coming into the consult room expecting antibiotics, and generally speaking, they're not necessarily appropriate.
Get your question answered at dralexanswers.com.
Right, so next up, Lee asks, could you please talk about anal gland problems in cats? Why do they develop anal gland problems? They've had a 9-year-old cat that's needed anal gland surgery due to an infection, and then she needs a checkup every 2 months, and just last time they were full again. So what's going on there? So let's start off with what anal glands are. So they're anal glands or anal sacs, kind of strictly speaking, and they contain kind of nasty, foul-smelling material that empties through ducts at around the 3 and 9 o'clock position around the anus. They're used for kind of marking territory, and they generally empty when a cat goes to the toilet. And actually in cats, don't cause as much of a problem as they do in dogs. And it's pretty rare or pretty uncommon for cats to get anal gland problems. So soft stools can lead to these problems. It can lead to the build-up of material within the anal glands, and that could be due to a number of reasons. It could be due to diet, an inflammatory bowel disease, parasitic disease, infections, and they can all prevent normal expression of the anal glands by the stools not being kind of their normal solid consistency, and that leads to impaction of the anal glands. Other causes can be inflammation in the anal area, and that can effectively block the anal gland ducts. So again, that stops them from emptying as normal. Anatomical reasons might be a problem. So if the ducts are too narrow, or if they're twisted, I'm not sure if that is a particular problem, but I do wonder, certainly in dogs, if that can be an issue for those dogs that get repeated problems despite, having nice firm stools and despite there being no outward problem. So I don't see why there's any reason that cats couldn't have that issue as well. And then finally, masses within the anal gland. So if there's a lump within the anal gland, that can cause kind of problems as well. The most common type is something called an adenocarcinoma, which is a malignant, and it's a pretty nasty mass. Thankfully, they are very, very rare in cats, although they are present from time to time. Okay, so that's what can cause the material to build up or be problems. Once you've got an impacted gland, then that becomes infected, and that can burst into the surrounding tissue. And as you can appreciate, that is incredibly painful. It causes an awful lot of inflammation, and a cat will be really uncomfortable if that's the case. So that's kind of anal gland problems. But what are the signs of them developing? So we want to pick it up, obviously, ideally, before they become infected and before they abscess. So that might be scooting, kind of rubbing their bum along the ground. Often with cats, it's more kind of a chewing or a licking around their back end. They can also be painful when they're handled. So they just don't want you to touch them, or you go towards, kind of stroking towards their tail, towards their bum, and they get really sore. And also they can be grumpy and unsettled. So cats will try and avoid pain wherever possible, and they're going to get grumpy if they think that something's going to hurt, and they're going to just change their general demeanor. So those are all things to look out for. And then how do we treat this? Well, we can treat this with just regular expression, or just expressing the anal gland. So if they've become impacted, or they're becoming full and on their way to being impacted, then we can empty them before they become a problem. Now, that's probably something that you're going to want your vet to do. It's a fairly disgusting job. It's not particularly difficult, but only if you know what you're doing, and you can cause more damage and more harm than good if you're not sure what you're doing. So definitely take them to your vet if you've got any problems there. So we can change diet. So if we've got a problem with loose stools, we want to try and get to the bottom of that. So we can switch to maybe a hypoallergenic diet. That will definitely help, or will most likely help in the case of an inflammatory bowel disease. We can increase the fiber in the diet. So that can be with pumpkin, with Metamucil, that kind of thing. But again, definitely with any diet change, especially if we're doing it for a medical reason, discuss that with your vet before either changing the diet or adding anything to your diet, because those solutions definitely aren't going to be appropriate for every cat. For example, if your cat has got kidney disease, then we don't want to necessarily be changing them onto a different high fiber diet. If the stools are persistently loose, then there are other tests we can do. So we can do stool tests, sending them off to the laboratory, looking under the microscope, that kind of thing. It might even be that we need to take gut biopsies or something. Now that's, getting up there. But if we're looking for an inflammatory bowel disease or even a neoplasia, a cancer, then that might be something that we need to do. So the bottom line is, if your cat has got persistently loose stools, if they're, it might not be diarrhea, but it might be kind of cow patty consistency, then, there are other investigations that might need to take place. And then finally, the last kind of solution, if you like, for anal gland problems, and especially a cat who has repeat anal gland problems, kind of despite trying everything, would be surgical removal of those anal glands. So they don't provide any vital function that the body can't do without, so we can remove them. Now, there is a very low risk of developing fecal incontinence after anal gland removal surgery. That is a very, very low risk though, so I wouldn't be overly worried about that. It's something to bear in mind because it does happen from time to time, but that is one way to completely eliminate and remove the ongoing future risk of anal gland impaction and anal gland abscesses. My next question is from Akila from India, and he has a 4-year-old entire male cat who is very anxious, is very stressed, has had behavioural problems for the past 2 years, and is just getting really aggressive. So the cat has bitten his dad for kind of 4 or 5 times, bitten his mum a couple of times, and he just doesn't know what to do. So they're actually keeping the cat outside on a tether so that he can't attack anybody, because they're just really worried that he's actually going to attack and bite them. He's getting very anxious if cats are coming into his garden, into his neighborhood. You know, that he's outside, so he's kind of watching the birds and he's watching the comings and goings. But yeah, he's getting really stressed. Whenever he's let off, he will go and he will have fights. He's also kind of looking to mate the other cats in the area, and they're just wondering what to do. You know, they really love their cat, but he's, you know, causing them a lot of stress as well as being under a lot of stress himself. And the comment is he's the angel from hell, so things are pretty bad. Now, there's a couple of things that we can do or can suggest here, and my first comment really is that entire male cats, they're very territorial and they've got a very high drive to breed. So that can explain, I think, a lot of the behaviour issues that we're seeing. So strange cats coming into another cat's territory, especially a male entire cat's territory, is going to be a massive cause of stress, and they're going to want to just go and see to those cats, let them know who's the boss, and get them away from their area. Being restrained as well and really not stimulated enough is not going to allow the cat to exhibit the normal marking behaviour, exhibit their normal behaviours, and that's going to be a form of stress as well. Now, obviously, we can't rule out medical issues causing pain or other issues that are affecting the cat's behaviour, and certainly pain is a big cause of aggression in some cats. Like I said in my last answer, cats are really good at avoiding, or they really want to avoid any causes of pain, and they're going to potentially become grumpy or aggressive if they're worried that something is going to hurt. So if you're going up to your cat and they're painful, they're going to either try and run away, they're going to hiss, they may even lash out if they feel that that's their only option. So, you know, there are a number of things that we can do. Now, I've actually got a guide to stress in cats on the website. If you go to ourpetshealth.com/resources, you can find that free guide, and that goes through some of the steps that can be taken in general to reduce stress. Now, in this case, neutering the cat, castrating the cat is going to it's going to be a big contributor, and so if we can do that, it's not going to fix it in one go, but it's going to reduce all of those behaviors that are driven by the hormones. Now, there are pheromone treatments as well, so Fellaway in cats is fantastic for helping them feel calm, helping them feel like the environment they're in is their home, is their safe space, and so that can reduce stress. Eliminating resource competition and access by other cats is also huge. So if you've got cats coming into the garden, it might be a case of actually just keeping this cat inside for a period of time so that he can get used to being in a situation where there aren't lots of other cats coming in and stressing him out. And then finally, mental stimulation is another big thing. So we want to be giving toys, we want to be hiding food or giving food and treat toys so that it takes a little bit of effort, it takes a little bit of thought for them to get a reward. Now, it can be quite difficult to play with cats, but that's something to do as well. But yeah, food, toys, food puzzles and things like that. I'm just spreading out the food in a room, mixing it up within a sheet so the cat has to burrow and find that food can all be a good strategy for just helping to stimulate a cat's brain and take their mind off other things. So those are a couple of things that we can do, but yeah, check out that free guide for other ways to reduce stress in cats.
You're listening to the Dr. Alex Answers Show.
And so before we jump into that next question, I just wanted to let you know that this podcast is actually brought to you by the ourpetshealth.com guide to stress in cats. So it's the free guide that helps you recognize the signs of stress, and that's a problem that often goes unrecognized, and it gives you steps to take to help your cat relax. Get it for free today. Simply head over to ourpetshealth.com/resources. The next question was sent in by Paul, and he says that a friend of his was interested in a dog, but he's concerned as it is line bred. What are your thoughts on this practice? And he's just done some reading up on it. And actually, as an addition, this dog is a result of a father-daughter breeding. So to start with, line breeding, it's not something that I've really knowingly come across in practice in the areas where I've worked, but is something that involves breeding from related dogs in the same family. Now, I don't feel that would be something really to be encouraged, and I'd really caution as to the potential long-term health of an individual bred in such a way. So if we think of dog breeding in general, it's produced so many problems through the narrowing of the gene pool to try and select for desired traits, and the result has actually been that while we may have achieve those desired traits, generally they're in the looks of the dog, they often come with a lot of problems attached. So we just have to think of Westies with skin disease, pugs with breathing and spinal issues, labs with hip dysplasia, Cavalier King Charles with their heart disease. The list goes on. And line breeding is a way to try and take in kind of the isolation of a specific characteristic to another level. So you're saying you've got this dog that either looks a specific way or behaves a specific way, and you're trying to really breed within that line to accentuate those characteristics even more. So, having said that it's a bad thing, that actually the level of inbreeding that's going on with line breeding, it does vary an awful lot. So it could be that the parents of the puppies are actually third cousins, and if that was the case, then the risk to the individual of developing kind of any problems and serious consequences of inbreeding is actually going to be very low, and it's probably not even going to be over and above the normal breed risks. So that wouldn't be something to worry about. And actually, if it's known that the dogs in a line are all healthy and they're all much better than the normal levels experienced within that breed, then a result of a line mating from such distant relatives is actually much more likely to result in a healthier dog. So the example would be if you've got a line of Westies and none of those have ever had atopic dermatitis, they haven't developed itchy skin, then actually it could be really desirable to line breed from those dogs, but making sure that the parents are really distantly related, not father-daughter related. So we can actually calculate kind of the risks, if you like, or the probability of problems developing, and that's by calculating something called the coefficient of inbreeding, and that essentially tells us how likely it is that the puppies will inherit identical genes. So too high a number, and we see health problems, we see a loss of vitality, we see poor growth. If that coefficient of inbreeding is very low, then we're less likely to get the desired benefits, but the health won't suffer either. So really, for health, we want to aim for a value of less than 5%. And in simple cases, parent-offspring matings have a coefficient of inbreeding of 25%. Siblings bred together have a level of 25% as well. Even first cousins have a coefficient of inbreeding of 6.25%. So those levels are all, significantly higher than that 5% cutoff. And we definitely don't want to consider this. So that is a father-daughter mating. That would be 25%. However, when lines are already inbred, and they're already significantly inbred, then the values can actually be much higher, even if at first glance the parents seem to be only distantly related. So it can become a very complicated calculation, but there are ways of working that out, and a good breeder should definitely be considering this when they're line breeding. As for father-daughter breeding in any situation, really, that's not something that I would recommend. I don't think it's a good idea. I think the risks are significant of having puppies that have compromised health. It's not going to be every puppy by any stretch, but there's definitely that risk. And if you're just looking for a pet, you're not looking to show your dog, and I could argue that even if you are looking to show your dog, we shouldn't be producing puppies that have a high risk of health problems anyway. But father-daughter mating in this situation, I'd really be steering well clear of. And then I just wanted to let you know to remember that the information I give in these podcasts, it's not a substitute for a consultation and examination with your pet's veterinarian, and it should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always the best course of action. And so my final question was sent in by Bridget, and she asks a lot about the feeding of dogs and cats. In particular, what's better? Is raw food okay? Is chicken, is beef better? Should we be feeding kibble? Is that the best thing that we should be giving our dogs and cats? How do we know what is the best thing to feed them? There's so much going on. There's so many different forms of advice out there, often conflicting advice, and it's really confusing to pet owners to know what to do. So there's lots to this question, and I've actually written a thorough guide to the pros and cons of raw and kibble feeding, and I'll encourage you to check that out if you're interested in this topic. But today I want to address the question, is raw feeding safe? Now, there's a couple of different risks to consider. The first is the risks to people, and the second is the risks to a dog and cat. Now, actually the health risks in people is really the big one. There's going to be a higher risk in young children, there's a higher risk in elderly people, and there's a higher risk in people who are immunosuppressed. So that's something to consider, but there is a risk to everybody. And really that risk is of E. coli, Salmonella, Campylobacter, or Listeria in particular. So they can cause really nasty infections and potentially fatal infections. They can cause outbreaks as well, and there have been outbreaks that have been linked to the raw feeding of pets. So that's something to consider. We can mitigate some of those risks through good hand hygiene, through proper preparation of the food in normal kind of kitchen, normal human preparation situations. So, taking the normal precautions you would when you're preparing your own meal. But we also need to consider that the dog or the cat is, they can be messy eaters. They lick a lot of other things. So after they've eaten, they're going to have those bacteria kind of in their mouth. If they're licking you, if they're picking up toys, then those bacteria, that infection risk is going to transmit to those things, which you may then touch and come into contact with. So it's not just their feeding area, it's not just their food bowls, it's not just that preparation that you need to be thinking about. It's the whole environment that your dog's around. So again, if you've got young children in the house, you definitely want to be careful if you're even considering raw food. It's not something that I would recommend, but check out that full article for that discussion in more detail. So that's in brief the risk to people, and then there's the risks to dogs or cats. So there's a couple here with raw feeding. So the first one is a lack of balance in the diet and deficiencies resulting from that. And that's been shown to be the case even if diets are changed regularly. Even if we're rotating through a number of different raw diets, different recipes, then it's been shown that there are still deficiencies. Now, whether that's causing problems or not, again, it's been reported. We're seeing in puppies rickets becoming a problem, which is ridiculous. We're seeing a lack of certain vitamins that again causing problems. So, that's one thing, a lack of balance and deficiencies. Infections, just like humans, just like the human health risk that I spoke about. So there's that risk as well in dogs and cats. And then finally, there's the risk of bones themselves if we're feeding a raw diet that's containing bones. And that's that risk is a number of things. So broken teeth is a big one. We'll often get kind of nasty fractures of the big upper chewing tooth. Intestinal obstruction and perforation is the other big one, and that can definitely be life-threatening if we're not performing emergency surgery, which obviously carries its own risks and its own expense. So, those are the risks of raw feeding. So is it safe? Well, I'd argue no, it's not safe. The question we then want to ask, though, is do these risks outweigh the benefits of raw feeding when compared to feeding a cooked or commercial diet? Indeed, are there any benefits of raw feeding? And, that discussion is too in-depth and too long to go into today. Check out that article linked in the show notes for more information. But I hope that answers the question or gives you some thoughts when it comes to thinking, is raw food and raw feeding safe for your dog and cat? And so that's it for this episode of the podcast. Be sure to subscribe. And if you have a spare couple of minutes, I'd really love it if you could leave me a review on iTunes or over at ourpetshealth.com/review to help more people discover this podcast and allow me to help more pets. Remember too to head over to dralexanswers.com where you'll find the links and downloads mentioned in today's show, as well as the form to submit your own questions so that can be featured on a future episode. But until next time, take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.